Hi, welcome to Organizing for Partnership, a 25-minute video presentation about the organizing campaign presently going on at the University of Iowa Hospitals and Clinics by the Service Employees International Union. My name is Gary Sanders. I've done a lot of public access television here in Iowa City, and with me tonight are Kathleen Cobble and Judy McCauley, two nurses at the University of Iowa Hospital. And let me just start right off by saying that, neither one of you really looks like you're real radical to me, and it seems like that's sort of how the nurses are being portrayed. I thought you'd bring bombs on the show or something. Kathleen, tell me, what is this about? First of all, why is it called Organizing for Partnership? What does that mean?
The Organizing for Partnership basically, Gary, means that the professional staff at the university is their main goal in the unionization attempt is to have a voice. And what we would like to accomplish through the organizing process is to be able to sit down with management and have a joint relationship where we can discuss and talk about how the university is ran, how patient care should be ran, and to work together as equals, and so that both of our talents can be used and that the benefits that come from the talents benefit the people of the state of Iowa more.
Mm-hmm. Well, that doesn't, as I said, sound radical. Judy, you want to sit down with management as equals and have a voice.
Have some voice in the restructuring that is going on, and we know it's necessary and we know it's happening, but we have no input.
Mm-hmm. Now, for those who might not be aware of the restructuring, what are you referring to?
Well, healthcare is changing, as we know.
Mm-hmm. Specifically at university hospitals.
Well, specifically
I don't know
across the nation,
yes.
There's a lot more managed care coming in.
Mm-hmm.
The number of days that are allotted for illnesses are dramatically decreased. There's a lot of concern with the Medicare and Medicaid programs.
Mm-hmm.
And this movement toward more of a managed care and decreasing costs, I believe, started on the coast and have been slowly filtering in. And the university, we are currently in the third year of a 5-year plan. They brought in a company to tell them basically how to do this restructuring, and their goal was to cut approximately $65 million from the budget of university hospitals and to maintain the level of care that you have.
Do you think that's possible, cut $65 million and maintain the level of care?
Now that we're in year 3, I can guarantee you, Gary, it's not the same level of care no matter what anyone else may say. The nurses who are there at the patient's bedsides daily know that it's not the same.
Mm-hmm.
And we do our very best. I don't believe that anyone would say that we've jeopardized anyone's health or have killed anyone in this process, but at what cost and what sacrifices to the staff that we have. We're all very devoted, well-educated people who do our very best and will continue to do our very best no matter what the outcome of this election is.
Mm-hmm. Well, are you guys just really out for more money here? Is that, you didn't mention that, but is that what's really behind this?
It's not my passion at all. My passion is patient care and always has been.
Uh-huh.
I've been in nursing in some form or the other for 37 years, and to see our patients get sicker, you can't stay in the hospital very long anymore. Come in, you have treatment or surgery, and we're to get you out in an incredibly short period of time. And this involves a lot of things. The patients are overwhelmed, we're stressed because of the seriousness of educating patients. It takes time to educate patients. In the first place, they have to be well enough from, in my case, surgery, in order to even absorb what we're the information we're giving them, and everything is rush, hurry up, and sicker patients, and more stress for everyone.
On my unit, I work in adult psychiatry, and our patients are coming to us iller than what they've ever have before, requiring more care. We're getting more physical care. They're not able to stay as long, and the number of staff members that we have caring for these people have been dramatically cut.
Like what? When you say dramatically cut, what do you mean by that?
What I mean by that is when I first started over in what used to be the old psychiatric hospital, our minimum staffing would be 6. Currently, we are down. We lost a couple beds when we moved over to the new hospital in the Papa John Pavilion, but we are now running with 2 nurses, 3 nursing assistants, and a split nursing assistant for both day shift, PM shift, for 22 patients.
So it's considerably less.
Considerably less. And when I had worked at the university 2 years prior to going over to the psych unit. At my time, when I was hired on psych, we received a 6-week orientation. The last nurse that was hired onto my unit was a nurse who had not done any hospital nursing in years, had never done an inpatient psych unit before. Her orientation was 3 weeks. And then after 3 weeks, she was required to pick up half the unit and be responsible.
So you're hopeful that the union, once it comes into the hospital and you people are, on the board of SEIU locally, will be able to generate more of a discussion with management in terms of cutbacks and things like orientation and so forth.
I guess, not to contradict you, Gary, but the one thing that I didn't like that you just said was about the union coming into the hospital. There's nobody's coming into the hospital. What has happened is the professional staff, because the unionization process, nursing, I believe, has like 1,400 people that are in the bargaining unit, but it's also social workers, pharmacists, physical therapists,
dietitians.
It's a wide variety of people.
Research persons.
And the union, the SEIU union, was asked to come in by the staff employees at the university hospitals because of the things that we were seeing happen, the patient care going down, seniority not meaning anything, seeing colleagues furloughed with no rhyme or reason. And SEIU brought their people in to help the nurses at the hospital to organize. The union is already in the hospital because it is made up of the organizing committee and the people that are in support of us coming together and to have an equal partnership with management.
And Gary, a point I'd like to make that Kathleen didn't make clear, my expertise since I became an RN 7 years ago has been in the surgical area, an oncology or cancer area, and I have no psychiatric experience except as a student. Now I could, on any given time when I go to work, find out that I need to go down and help them, and that would be with no orientation.
No, they can just ask you, or tell you, I should say, that you have to report to a unit that you have no knowledge of at all.
Gary, several months ago, I had a transplant nurse work with me. They had been pulled down to our unit to work in a locked psychiatry unit with no psych experience, with no violence management. And my unit is a psychotic disorder unit with 5 research beds for the clinical research center that have potentially 5 schizophrenic patients totally off their antipsychotic meds.
Now, have you discussed any of this with management, your supervisors or whatever?
I have, because of my family life, I have made the decision for the last 3 years to work straight weekends. Due to the fact that I'm a senior member of the nursing staff on the unit, I have a lot of experience. And I have taught to both the supervisors, and for the most part, if the supervisors are able to, if they have people in the house, they will bring people in. But again, these people they may come from a surgery unit or from a GI unit, who again have no expertise, no experience in psych. I've also taught to our head nurse. Other members in my unit have taught to our head nurse. She has come back to us after we have raised questions of safety with our supervisors, and in the next day she says to us, I don't want to hear about safety anymore. Be thankful for what you have.
Really?
And I have told my husband that if I would ever get killed on the unit, because this is something that is very possible, not to believe a word that the university says, but rather to talk to the people that I was working with, because they would know if the staffing was at a safe level, and if it was just an accident, or if something such as poor staffing or poor training had occurred.
So we have another issue here, this safety issue.
Of the employees.
Of the employees.
As well as
My-
the patients.
Yeah.
My area, I'd say I would worry more about the safety of the patients. And as I said before, Gary, they're becoming more ill and need more attention, and are what we call acuity, or the level of care that patients need, can increase rapidly during a shift.
Now, Kathleen mentioned seniority going down and people being furloughed. What does that mean?
Well, there was restructuring. They decreased management drastically, so these persons were given the opportunity to find an area to apply to. And I'm working beside nurses with lots of education that have been managers or do teaching. This is their long-time area of expertise, and now, you know, they're working right beside me. That doesn't necessarily make for really happy employees.
But not only was it management, Judy, that was affected, it was other staff nurses.
sure.
An example
Clinic
was in
nurses.
the ophthalmology clinic. They had numerous nurses in that position, and when they opened up the new eye clinic, the positions that were available for the staff nurse was half, and all those nurses had to apply for half the positions, and then they were absorbed going any place else within the hospital. And again, in a unionized university, what would happen, the people with the higher seniority would be the last to go, or would be the last to be cut. This wasn't true. There was no explanation how it was chosen, who got those positions. I mean, everybody had to reapply for those positions. It wasn't according to seniority. And in a lot of cases, as in the peds clinic, the ophthalmology clinic, those positions went to nurses maybe with less experience, and they let old-time nurses who had a book of knowledge just from their years of practice go. And now all of a sudden what we're hearing is, well, there's positions opening up, and what they're doing is hiring new graduates who have no experience.
For less money.
And they're cheaper.
Yeah. Now, this furlough, do you mean people are fired, or?
What they did for a lot of people was maybe offered early retirement, or saying, well, you know, you can have a position someplace else in the hospital, and then they would be offered at the same pay level for a brief period of time, but then it would go down.
Well, so we've got patient care becoming, you know, worse, really, and seemingly from what you said.
We're trying.
No, I know
We're
you
trying
have.
really hard.
I would not say that patient care is worse, is bad. I mean, I think that the nurses have done everything that we can to make sure that the people are being taken care of. But what it has caused the staff nurses at the hospital is to maybe be putting in 1-2 hours of overtime, not taking any breaks, and then we're not being paid for our overtime. They say, we'll give you comp time. But we're so short-staffed, Gary, we don't get to use the comp time.
So everybody's working harder, longer.
Many of the nurses I work with, we're going part-time. We can't physically and emotionally take the stress. And when we do get new grads, when someone leaves, they're often not replaced. It's very much, as it appears to me, a game of numbers.
Well, all right, so we have this, you know, incredibly more stress on the people who are there.
And nurses that are thinking very seriously of leaving the profession. And it's a very specialized, we work in very specialized areas, and no one can know everything about every specialty in an area like the University Hospital.
Well, why do you think some people, after what you're telling me, you know, portray this unionizing effort as outsiders coming in stirring up trouble? Where does that come from?
I think it comes from several different factors. I think one factor is that the administration at the hospital is having a hard time accepting the fact that the staff, the professional staff at the hospital, are not happy with the decisions that they've been making and are asking to be able to have a voice in what is going on. The other aspect, I think, is there's been a lot of misinformation during this campaign that has come out, and I think that this has given a lot of negative tones to the union where there shouldn't be any.
Where is this negative tone coming from?
The university felt a need to hire MSA, which is Management Science, I believe, Associates. And basically this is a group of lawyers who are coming in. The staff at the university was told that the nurses and professionals at the university were crying out to Dean Borg for more information. And what they hired are a team of lawyers, and from every bit of information that I have seen, their main goal is to break the union.
Judy, have you come in contact with any of these people from MSA?
I can't actually say no that I've met them, although we have new guards, a new company that I understand was associated with this MSA.
Guards?
Guards, security guards.
Wells Fargo guards.
Yes, that's, I spoke to one, and he told me that he'd been employed to look for union persons.
And did you say, well, you're looking at one, or?
That's a good point. Yes, that is a very good point.
Well, have you received any?
He also stated to me that he didn't think he'd know one if he saw one.
So he's just taking his money and...
He's a very nice person, I'm sure.
I wonder what, I mean, is he going to, are they supposed to run them out of the hospital?
He was said that, you know, he was waiting, you know, for a complaint, for nurses to complain that there was union bothering them, and then he would be called to that area to deal with this.
Well, have you received anything in writing from management?
No.
Or from Management Science Associates, from your supervisors, from anybody that says why you should vote no on this, or?
Oh, yes.
Yes.
Anything in writing?
Yes.
Yes. I think it's important for us to say that the MSA is a firm that they brought in, and Martin Levitt is a former employee of a firm that was very much like MSA, and he will be coming to talk sometime in the future here in Iowa City, hopefully, about the techniques that are used with this, with this type of a campaign. And the MSA basically cannot legally talk to any of the staff people at the hospital. That is against the law. But what they can do is hold they've been holding 4-hour training sessions with the supervisors, with the head nurses and the assistant head nurses, to train them how to talk to us. And these are people that we've been talking to for years. And then they have been bringing out articles such as Judy has, Know the Facts. And it's all very skewed information. And I mean, and it is true there. It says in the code that the employer and employee organization shall meet to negotiate in good faith with respect to wages, hours, vacations. But then they have underlined mutually agreed upon. And so our people at the hospital that are undecided if we should go union or not see that, and then they say, oh, well, we can't negotiate staffing. Well, because of the way it was presented there, that was the attempt that they've been using. But it's not true. Staffing can be negotiated because the way that it's dealt with and looked at, you know, maybe we can put in to the contract exactly what we need for our staffing, and that if it's not met, then there are going to maybe have to be financial things that the hospital will have to supply us with. Maybe, you know, pay us more if the staffing isn't what it should be, for example.
Judy, has anybody in management said to you, you know, boy, you're really barking up the wrong tree here. You're a troublemaker, and this is going to be the worst thing that could happen to the hospital, or anything like that?
No, it was more subtle than that. In fact, this happened to me yesterday. I was told by a supervisor that, you know, I wasn't a troublemaker, and but basically misinformed. And did I really think that the union could help with things like staffing? Didn't I agree that there were changes in nursing? Well, of course I agree. There's tremendous changes in nursing. But yes, I do think it's possible. Because,
Kathleen?
excuse me, but they do cite in here, they do put their own paragraph in here saying simply stated staffing levels and work assignments, as in also floating, are exclusively within the right of the employer, which is not exactly what that says.
No, and again, such as the floating option or part, that is called a permissive bargaining topic. And what that means is that we can demand that we want to bargain on it. And if the university says, no, we're not going to, then what we can do is take it to an arbitration, and then the arbitrator decides if it's an issue that's bargained on or not. And people have been led to believe these misfortunes that we've not. And in fact, I had a supervisor that came and told me there were only 4 things that could be bargained, and that the rest the university would have to agree upon. And if not, then there was nothing more that we could do. And again, that was misinformation.
Well, we only have about 2 minutes left, and it's interesting you bring this out about management, because I'd like to certainly invite anybody from management, either at the hospital or Management Science Associates of Kansas City or Wells Fargo, to come on, either with you folks. Would you be willing to do that?
I would really like to talk with any of them.
And we'd be happy to have another video where we can get their side and you know, try to get to the bottom of this, because it seems like there is a lot of misinformation out there in the community. And just to wrap up, have you folks, you know, heard about members of the community trying to help SEIU and you folks?
Yes, there's a community coalition that is supporting us 100%.
It's a tremendous, there's a petition drive with petitions circulating by Iowa Cityans stating that they do not like the fact of MSA being here and they want them to leave town. And they're asking for various people to sign that.
Well, certainly I find it interesting, you know, as a patient up there, that I guess some of my money that's going from my bill is being paid to some out-of-town outfit.
And Gary, I don't feel
$100,000, $200,000.
An Iowa City issue.
How much are we going to pay?
It's a state issue. Any patient.
Anybody from around the state who's coming here, part of their money is going to do this.
Gary, the money that we've been told that's going to be spent is $1.5 million.
$1.5 million. Well, folks, we've got to wrap it up for tonight. Again, I invite management to come on again, and also what we primarily focused on tonight was nurses, because we had 2 nurses here
Not to forget
today.
the other disciplines.
Kathleen Cobble and Judy McCauley. We don't mean to slight anyone else. We'd be happy to have them on and discuss this with any of the other members of University of Iowa hospitals and clinics who are affected by this. And we hope to do more of these, because we have to get some real information out as opposed to the misinformation
True.
that's going on. Thank you very much for joining us. Once again, my name's Gary Sanders, and you've been watching Organizing for Partnership. Thank you.